In the last part of this section, we're going to talk about Chapter 3 in the text, which is basic pharmacology. In the text, they also have and other common therapies, and we're not going to talk about that section. So we're going to talk about the pharmacology part, and then when we get to page 48, and they're talking about different kinds of therapy, we are going to skip that section. So we're basically going to talk about the pharmacology. Also then, when we get into the different systems of the body, we will talk about specific pharmacology for those different areas. One of the reasons why we need to know about pharmacology is we need to know about potential side effects for our patients. It's certainly outside the scope of a physical therapy practice to prescribe and recommend medications, but we still need to be knowledgeable about the medications that our patients are taking. Frequently, people ask me, they say, oh, well, should I cut down on my pain medications, or should I? And my answer is always, that's something that you need to consult your doctor about. You need to talk to your doctor about medications. That's not something that I can recommend for you. People ask me things like, they'll say, does everybody have this problem with the pain medications? And my answer for that is usually, everybody responds differently, and you're going to have a unique response. So we need to know about the pharmacology, but that is really outside of the scope of our practice to give medical advice around it. So there's that. That having been said, there are definitely pharmacology questions on the board exam. And a lot of them have to do with, oh, you're treating a patient that is on this type of medication. What do you think they're being treated for? Or something like that. So pharmacology, it's an integrated medical science that involves chemistry, biochemistry, anatomy, physiology, microbiology, and more. It's really the study of drugs and their actions, dosage, therapeutic uses, and adverse effects. So drug therapy is directly linked to the pathophysiology of a particular disease. Drugs may come from natural sources, such as plants, animals, and microorganisms, or they may also be synthesized. I just recently read this study about a new drug that's being worked on for Parkinson's disease, and they're calling it, at this point, G514. And the G comes from the fact that it was derived from a substance that was found in Gila monster saliva, which is pretty neat. So it comes from an animal. It's now being synthesized synthetically, but that's where it originated. So a lot of the drugs come from the natural world. So that's one of the motivations for preserving the natural world, is there might be something out there that's going to cure a disease that we don't even know about yet. But I like the little cartoon where the doctor says, this prescription won't make you feel better, but it'll stop your whining and make everyone else feel better. So, maybe we all need some of that medication. So, drugs, they can promote, they have lots of different effects, and I'll talk about what their effects are potentially and what type of medications do those things. So, drugs can promote healing, such as anti-inflammatory medications. They can decrease inflammation in a local area and promote healing. They can cure disease. So antibacterial drugs are a good example of that. They can actually cure the problem. They can control or slow the progress of a disease. So cancer chemotherapy is a good example of that. It's trying to slow the growth of a neoplasm or tumor. They can prevent disease, like a vaccine. Drugs can alter neurotransmission, like antidepressants. Things like Prozac and Zoloft, they're selective serotonin reuptake inhibitors, SSRIs. So they alter neurotransmission by allowing they inhibit the reuptake of serotonin. They allow the serotonin to persist longer in the synaptic cleft, giving you more use of it, which is great. They decrease risk of complications. So anticoagulants are an example of this. you had knee surgery and you're taking anticoagulant to avoid getting a blood clot, which would be a complication of that surgery, potentially. They can increase function and comfort. So analgesics for pain can increase your function and comfort. They can provide replacement therapy. So any hormone replacement therapy like insulin or any other type of replacement therapy. Synthyroid that replaces thyroid hormone. They can reduce excessive activity in the body. There's medication type that's called proton pump inhibitors. There are some inhibitors that in cardiac medications that reduce excessive activity in the body. So there are lots of different disciplines in pharmacology, and a lot of, they all combine to come up with ways to use medications to treat disease. So there are different effects of drugs. Some of them are therapeutic effects or desired effects. They can stimulate or inhibit cell function. They can block biochemical actions in tissues. They are classified usually by their primary pharmacological action and effect. So when they talk about diuretics and anti-inflammatories and anticholinergics, that's their primary effect. They might also have secondary effects, but that's their primary effect. Indications are approved uses to treat conditions for which the drug has been proven to be effective. So a lot of, in order for a drug to get approved for use, it has to go through a lot of trials. And so it's, when a drug gets approved, it means that it has been proven to be effective to treat certain conditions. So usually drugs possess more than one effect on the body. So they have the desired effect, and they also have undesirable effects. Like the announcer in the picture, may cause depression, insomnia, diarrhea, ulcers, fatigue, nightmares, nausea, blah, 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 or death. And you hear that on ads on TV all the time. If you watch ads on TV, you hear about all the side effects of drugs. So that was one of the things when drug companies were first allowed to advertise on television. The stipulation was that they had to list all the potential side effects. So contraindications are circumstances under which a drug should not be administered. We will also, when we talk about modalities, we'll talk about indications and contraindications for modalities as well. So it's circumstances under which a physical treatment should not be administered. Side effects are mild, undesirable effects of a drug, even at recommended dose. So an example of a side effect for some drugs that's mild yet undesirable would be a dry mouth. So you're taking it at the recommended therapeutic dose, and yet you have this side effect. It's not toxic or life-threatening, but it's undesirable. Adverse or toxic effects are drug effects that are dangerous, cause significant tissue damage, or are life-threatening. So probably in the graphic, the depression and insomnia and diarrhea and nightmares are the side effects, and the addiction and death are the toxic effects, adverse effects. I don't know, you take your choice. So specific adverse drug effects can include hypersensitivity, which are allergic reactions. Allergic reactions can be mild, or they can result in anaphylaxis, which is a life-threatening allergic reaction that causes you to stop breathing. You can have idiosyncratic reactions, which is an unusual response to a drug. So it's your own response that you have to a drug that wasn't one of the ones they were expecting. Iatrogenic adverse effects of the drug, it's a negative effect associated with administration of drugs. So taking that drug causes another problem. So you'll see ads for drugs and they say may cause hyperglycemia or low blood pressure or something like that. So that's an iatrogenic effect. It causes another problem. There are teratogenic effects, which those are drugs that may have a harmful effect on a fetus or cause developmental defects in an unborn child when the mother takes the drug. So there are also a specific adverse drug effect is interactions. So the drug effect can be modified by combination with another drug. And there are different modifications that can happen. One of them is synergism, where the effect of the drug combination can be greater than the sum of the effects of the individual drugs. So you can get an exaggerated effect with both drugs. You can get antagonism, where the combination greatly decreases the effect of each drug. Sometimes you'll get medications which say that you shouldn't take it with food, or that you should take it with food, or you shouldn't take it with other things in combination because of antagonism or synergism. Potentiation is where one drug enhances the effect of a second drug. So an example of this is there's a Parkinson's medication that a lot of people take. The brand name of it is Sinemet. It's carbidopa-levodopa, and it is it's a precursor for dopamine. Dopamine itself can't cross the blood-brain barrier, so you take L-dopa, which is a precursor for dopamine. It crosses the blood-brain barrier, and then in the brain gets converted to dopamine. There are dopamine agonists that enhance the effect of Sinemet. So that is considered potentiation, and it's an additive effect, basically. So the dose of a drug is the amount of drug required to produce the desired effect in an adult. And it's expressed by a weight or a measure and a time factor. So like twice a day. Two pills twice a day, or something like that. Or 3 tablespoons twice a day. A child's dose is usually calculated by the child's weight, not the age, because as you probably know, children vary a lot in size. Sometimes a larger dose or a loading dose can be administered initially to raise blood levels to a therapeutic or effective level quicker. So a lot of times that happens with antibiotics. They start with a higher dose and then taper off to a lower dose. Prednisone is another one where they'll taper you up and then taper you down. It's a corticosteroid. So the frequency of dosing is important to maintain effective blood levels of the drug without reaching toxic levels. So an optimum dosing schedule is established for each drug based on the absorption of the drug, transport in the blood, and the half-life of the drug, which is how quickly it is eliminated from the body. So the timing is given usually by the pharmacist with directions regarding timing related to meals, like take before meals, or take after meals, or take with meals, daily events, and sleep. So sometimes you have to take it before a certain time, or after a certain time, or right before sleep, or right when you get up, that sort of thing. So the idea of that is it's based on absorption and transport and the half-life of the drug, and then interactions with other things like food. So for regular intake, normal distribution, and excretion, you want to maintain that desirable blood level so the drug is effective but not toxic, and it's not too low to be effective. So the timing and dosing of the drug affect that. So this is sort of the ideal situation where the timing is set up so you maintain that desirable level. This is having the drug at irregular intervals and missing doses. So you end up, part of the time it's too low to be effective, part of the time it's effective, and part of the time you're getting into the unsafe and potentially toxic range because the blood level fluctuates so much because you don't have regular timing and dosing. If you take a double dose or take it too frequently, you can get into blood levels of the drug that are dangerously high. So factors that influence the blood levels of a drug include liver and kidney function. So that's one of the parts of pharmacology is how is the drug eliminated from the system. Some drugs like acetaminophen, Tylenol for example, is eliminated through the liver. Some drugs are eliminated through the kidney. So you have to know how it's absorbed and how it's excreted. Someone who has decreased kidney function, it's going to take them a longer time to clear that drug from their blood. Or if someone has depressed liver function. Circulation and cardiovascular function, of course, is going to affect that. Age. Older people are going to have different effects with drugs. And younger people. Body weight and the proportion of fatty tissue is going to change the blood levels of a drug. Activity level and exercise, food and fluid intake, genetic factors, and health status, comorbidities, the presence of other diseases. So, drugs can be administered to act locally or to have a systemic action. So, the drug enters the body by the chosen route, and we'll talk about that in a bit. It's absorbed into the blood or acts at the local site. It travels in the bloodstream. It arrives at the site of action. It exerts its effect. It's metabolized into inactive compounds, and it's excreted from the body. That's the route of drug administration, hopefully. The routes of drug administration include oral. So you take either a tablet, a capsule, or liquid by mouth. Sublingual, which is where you put it under your tongue and it dissolves. With sublingual administration, it's dissolved directly into the bloodstream. So an example of this would be taking vitamin B12 sublingually. People that have pernicious anemia, they lack intrinsic factor to process the B12 in the stomach. And so if they took it orally, it would just get broken down in the stomach and it wouldn't be properly processed. But sublingually, it gets into the bloodstream. Subcutaneous injection goes under the skin. Intramuscular injection goes into the muscle. So usually with B12 supplementation, it's done sublingually or intramuscularly. Intravenous injection is where it's injected into a vein. Inhalation is where you inhale it. So there is a form of the flu vaccine that is inhaled rather than injected. And a topical administration is through the skin, a gel, cream, spray, or liquid. And suppository is inserted rectally, and it's absorbed that way. So lots of different routes for drug administration. So part of pharmacology is they decide what is the best route, what is the route that is most effective. So some drugs can only be taken via one route. Oral medication is absorbed from the stomach or intestine, transported to the liver, and then released into general circulation. Intramuscular injection is gradually absorbed into the blood, and the blood transports the drug. So some drugs can't be absorbed through the stomach or intestine, and so they have to be injected. One of the MS medications that is out fairly recently, it's called Tecfidera. It's an oral medication. It's one of the first disease-modifying oral medications. Before, they had to be done by infusion. And so, despite the fact that it has potentially horrible side effects, a lot of people I know with MS take it because it is so much easier to take an oral medication than it is to go in every month for an infusion. So this is sort of the little graphic from the book for the different paths of absorption. It has the oral ingestion up there in the top left corner, the intravenous injection, the intramuscular injection, and it just shows the different routes of metabolism. So common pharmacological action requires drug-receptor interaction. So drugs may stimulate receptors directly, or drugs may block the receptor site for normal chemicals in the body. The specificity of the drug is dependent on the mode of action. Drugs that interact with several metabolic pathways or common functions are likely to have greater side effects. So some examples of these, we have opioid receptors in our body because our brain creates endogenous opioids that help control pain in different areas. So opioids derived from plants can bind to those same receptors and have the same effect in the body. The anti-smoking drug Chantix is one that binds to a nicotine receptor and blocks that receptor site so nicotine can't bind to it. So people who are taking Chantix don't get the same effect from nicotine, and they can break their addiction to it. We have a lot of receptors in our body that are nicotinic receptors, and so there can be side effects from that because it covers a lot of different areas. So this is kind of the two different receptors and drug actions. One of them is the drug stimulates increased activity in a particular tissue where the receptor is. One of them, it binds to the tissue and takes up the receptor site and blocks the entry of a natural substance in the body. So one of them increases activity, the other one decreases activity. So there are different drug responses, and we'll talk about each one of them. So dose effects, all drugs are potential poisons, depending on a number of factors. Determination of a correct dose or dose level, the therapeutic effect has to be balanced with possible toxic effect. So with everything, they want to establish the minimal effective dose. So you get desired positive effects with minimal potential toxic effects. That's the case with physical modalities as well. We want to do the minimum effective dosage. We only want to do what we have to do to get the effects that we want and not cause any other problems. Time effects, the time of administration, the onset of the response, the cessation of the effect, the peak effect, the duration of the action, the latency to the effect, how long does it stick around, and the threshold level. So a lot of things are affected by the timing of drugs. There are some drugs that have what we call on-off times, where they reach their peak effectiveness and then they sort of dribble off, and then it's time for another dosage, and you have to time that out during your day. So there can be variability with drug effects. Not everybody's going to have the same response to a drug. Depending on the chemical properties of the drugs, you can have different toxic effects. If someone has liver and kidney disease, we discussed this a little bit earlier, they are going to eliminate the drug differently, so they're going to have some variability on their timing. Age is a factor, genetics, gender. For Tylenol, for example, acetaminophen, women have a harder time eliminating Tylenol from their body than men do. It has a stronger effect on your liver. So the FDA announced a couple of years ago different dosages of Tylenol for men versus women. Your metabolic cycles affect drug variability and just your overall health. So toxicity, it's the physiochemical properties of the drug that can cause toxicity and the routes and rates of administration. the rate of absorption, biotransformation, and excretion. So if any of those things are changed, if your rate of absorption is faster, you could reach a toxic level sooner. If your excretion is slower, you could stay toxic longer. So it's definitely something to consider. A prescription is a signed legal document that must include the patient's name, address, and age, if age is relevant. The prescriber's name, address, and they have a DEA identification number. The date, the name and the amount of drug, the dosage, the route and directions for using the drug, and permission for additional quantities. So they'll say, oh, you can get 2 refills of this or something. In Washington, actually several years ago, they made a law that prescriptions have to be printed out. They can't be handwritten, just to avoid errors, basically. Each drug has a generic name, a trade name, and a chemical name. The generic name is a unique, official, simple name for a specific drug. For example, acetylsalicylic acid is it's like the chemical name for the drug, or its unique, official, simple name. There can be trade, proprietary, or brand names like aspirin or Bayer aspirin. That's a trade name or a brand name. Or the chemical name is the chemical component, acetylsalicylic acid. So each drug has all of those things. So this is some examples of drug nomenclature. So the generic name, which is non-proprietary, diazepam. The proprietary names, which are what each individual company calls it, are Valium is a trade name, Vival, apodiazepam, and Diastat. And then the chemical name, I'm not going to read that out to you. Ibuprofen also goes by Advil, Motrin, all those different names. Nuprin, I don't know if Nuprin's still around, but it was when Advil first came out, there was Nuprin. And that's its chemical name. Hydrochlorothiazide, that's a common diuretic that's used to treat high blood pressure. It has several different trade names and its chemical name. So a lot of times people will know their drug more by the trade name and occasionally by the generic name. So I always call any ibuprofen Advil. I don't know why, that's just what I do, but you'll hear drugs called by all sorts of different names. And if you're not sure what something is, look it up. It used to be we'd look it up in the PDR, the physician's desk reference, but now we can look it up on the internet, and it's fast and easy. So in the U.S., the drug regulation is by the FDA, the U.S. Food and Drug Administration, which regulates the production, labeling, distribution, and all other aspects of drug control. In Canada, it's the Food and Drug Directorate. There are scheduled drugs, which are drugs that are considered to have a risk for potential adverse side effects, abuse, or dependency. And in the book, it lists the different schedules of drugs. I don't expect you to memorize that or anything, but it's just interesting to know. It's on page 47, Schedule of Controlled Substances, and it tells you why it's controlled, why it's scheduled. There are over-the-counter drugs, OTC, which are available without prescription. So Advil used to be just prescription, and now it is OTC. So